Imagine your dentist spotting something in your mouth that could warn you about your heart years before your cardiologist ever does. This isn't a gimmick. What starts as a routine checkup could be the earliest real warning sign of one of the deadliest conditions of our time, and almost nobody knows it. Before we go further, if you care about your heart and living a longer, healthier life, hit that like button and subscribe to this channel. It genuinely helps us reach more people with information that matters. My name is Dr. Adrian Vogel. I've spent over 20 years working in cardiology and preventive medicine, and in that time I've seen how often people overlook warning signs that were right in front of them, sometimes literally in the mirror while brushing their teeth. That's exactly what we're talking about today. The surprising, scientifically documented link between your gums and your heart. And by the end of this video, I'll show you the exact mechanism, a single, specific culprit that can literally travel from your mouth into your arteries. Most people have never heard of it, so stay until the end, because this detail might explain why some people suffer a heart attack despite having normal blood test results. Let's start with why the mouth has anything to do with the heart at all. It sounds strange at first, two completely different organs, separated by the rest of the body. But the body isn't a collection of isolated parts. Everything is connected, mainly through the blood that flows through every tissue, and through an immune system that reacts wherever it senses a threat. When the gums are chronically inflamed, a condition called periodontitis, the mouth becomes a constant construction site for the immune system. Bacteria colonize the pockets around the teeth, the tissue becomes irritated, bleeds easily, and the body keeps sending inflammatory cells there. The problem is that this inflammation doesn't stay local. Research over the past 2 decades has shown that inflammatory compounds and even bacteria themselves can enter the bloodstream and travel virtually anywhere, including to the walls of your blood vessels. This is exactly where the dentist part of the story comes in. An experienced dentist is often the first person to notice the early signs: bleeding gums, receding gum tissue, loosening teeth, deepened periodontal pockets. For most patients, that registers as just a dental issue. But for someone who knows the research, it can look like an early warning system for something much bigger, a systemic inflammatory state that may directly affect the cardiovascular system, often years before classic symptoms like chest pain or shortness of breath ever show up. Here's something very few people know. Several large observational studies have shown that people with untreated advanced periodontitis have a significantly higher risk of heart attack and stroke compared with people with healthy gums, even after accounting for other risk factors like smoking, weight, and cholesterol. That doesn't automatically mean poor dental care directly causes a heart attack, but it does mean your mouth can act as a window into how your immune system and blood vessels are responding to chronic inflammation. Before we get into the mechanism itself, it's worth pausing on how many people are actually affected. Estimates suggest a substantial share of the adult population worldwide has some form of gum disease, and many don't even know it, because the early stages are nearly painless. That's exactly what makes it so dangerous. A condition that develops quietly while, in the background, the arteries may also be affected. And that's exactly the hook that makes this whole story matter. In the next section, I'll show you what this inflammation actually does inside your arteries, and why a specific lab value, one almost nobody asks for during a routine checkup, is often the very first real clue that something is wrong. Before we continue, an important note: everything discussed in this video is for informational purposes only and does not replace professional medical advice, diagnosis, or treatment. If you have health concerns, especially regarding your heart or your gums, please consult a qualified doctor or dentist who can evaluate your individual situation. Now back to the science. When bacteria from inflamed gums enter the bloodstream, they trigger a chain reaction. The immune system responds by releasing inflammatory markers, including a protein called C-reactive protein, or CRP. This value is increasingly used in cardiology as an additional risk indicator, since elevated CRP levels are associated with a higher risk of cardiovascular disease. Interestingly, chronic gum inflammation can drive this exact marker upward, something a standard cholesterol checkup often completely misses, since it typically focuses only on fat and blood sugar levels. Here's where it gets even more concrete. This inflammation contributes to a process known as atherosclerosis, the hardening and narrowing of arteries due to plaque buildup. Picture the inner lining of your blood vessels like a smooth road. Chronic inflammation acts like constant construction traffic, tearing up that surface and leaving small cracks where fat, calcium, and cellular debris can accumulate. Over time, the road narrows, blood flow becomes restricted, and the risk of a blockage, a heart attack, or stroke increases. Several scientific and cardiology associations have, in recent years, officially acknowledged a statistically significant relationship between periodontitis and cardiovascular disease. Importantly, the science is careful with the word cause. It hasn't been proven beyond doubt that gum disease alone triggers a heart attack, but the association is robust enough that many physicians now consider gum health to be one of several pieces in the overall picture of heart health, alongside blood pressure, cholesterol, and physical activity. So what does this mean practically for your next dental visit? A good dentist doesn't just check for cavities. They measure the depth of your periodontal pockets, observe whether your gums bleed during probing, and look for signs of gum recession. That information, combined with your general medical history, can signal to an attentive practitioner there might be more happening in the body than just a dental issue. This is exactly the part that surprises so many people, the idea that a routine dental cleaning could indirectly contribute to heart health. In fact, some studies suggest that successfully treating periodontitis is associated with improvements in certain inflammatory markers and even measurable improvements in blood vessel function. This isn't a miracle cure and doesn't replace cardiac treatment, but it shows just how closely these two areas of medicine are actually intertwined. You might be wondering now, what specific signs should I watch for myself, even before going to the dentist? Gums that bleed during brushing and don't stop on their own? Persistent bad breath not explained by diet? Gums that recede and make teeth appear longer? And loose teeth in adulthood? These are all signals worth paying attention to. None of them alone proves a heart condition, but each one is a reason to mention it to both your dentist and your doctor. And here's the part that makes this whole story even more interesting. There's one very specific strain of bacteria that keeps showing up in research whenever scientists examine the inflamed plaque in arteries of patients with heart disease. This strain has actually been found directly inside arterial tissue, not just in the mouth. What that finding actually means and why it surprised researchers so much, that's exactly what we cover in the final part of this video. Before we get to the reveal, one more important question many of my patients have asked: if I improve my gum health, does my heart risk automatically drop? The honest answer is, it probably helps. But it's not a substitute for the classic pillars of heart health: managing blood pressure, keeping an eye on cholesterol, staying active, not smoking, and eating a balanced diet. Gum health is an additional, often overlooked piece, not the only key. Now, the reveal we've been building toward this whole time. The bacterial strain I mentioned earlier is called Porphyromonas gingivalis, one of the main organisms responsible for periodontitis. What researchers have discovered in recent years is fascinating and, frankly, a little unsettling. When examining arterial plaque removed from patients with advanced atherosclerosis, this exact bacterium has been detected in a notable proportion of samples, directly inside the artery wall, far from the mouth where it's normally found. That means this bacterium doesn't seem to just cause damage locally in the gums. It appears capable of traveling through the bloodstream, settling into the walls of blood vessels, and potentially contributing directly to inflammation and plaque progression there. Some researchers even suspect it produces certain enzymes that make surrounding tissue more vulnerable to inflammatory damage. This is one of the most concrete, well-documented biological mechanisms explaining why oral health and heart health might be so closely linked. Not just a coincidental correlation, but a traceable path from the mouth to the cardiovascular system. This isn't meant to scare you. It's meant to leave you with one important insight. Your twice-yearly dental cleaning isn't just cosmetic. Scientifically speaking, it's part of your cardiovascular prevention, something most people completely underestimate. So the next time you see blood in the sink while brushing, don't dismiss it as a minor inconvenience. See it for what it might be: an early signal from your body that's worth taking seriously. Here's what to take away from this video. Get regular dental checkups. Talk openly with your dentist about bleeding or receding gums. And if you already have risk factors for heart disease, mention that to your dentist too. These two areas of your health are far more connected than most medical fields traditionally treat them. If this video showed you something new and valuable, go ahead and like it now, subscribe to Lebenspulse for more evidence-based health content, and share this video with someone who might need it. If you or someone you know has experienced this condition, share this video with them and tell us in the comments, which city are you watching from? We love hearing from our Lebenspulse community around the world. Stay healthy, stay informed, and take care of your heart. From the inside all the way out.